Now, the federal government is now considering home care for COVID-19 patients as bed space is becoming a challenge. This is especially for Lagos, the epicenter of the pandemic in Nigeria. The Director General of the Nigeria Center for Disease Control, Chikwe Hekwazu, stated that there are about 3,500 bed spaces available for COVID-19 patients across the country, but government is working to make more bed spaces available. Joining me via Skype is Dr. Tolu Olufunlayo, Chairman, Association of Public Health Physicians of Nigeria, Lagos branch, and a consultant public health physician. Thank you for joining us on TVC Breakfast.
Thank you. Good morning.
Now, at the stage that we are in and trying to flatten the curve and also curb the spread of COVID-19 across the country, is this a viable option that we should perhaps engage in?
Well, thank you for this question. The reality is that we are at that stage now where we are outstripping our resources, and we have to consider alternatives. We have to think outside the box. Though the World Health Organization recommends that ideally every case of COVID-19 should be managed within a health facility. That is because of its high level of infectivity. It also does give the caveat that where these facilities seem to be overstretched, decentralized forms of management, of which home management is one, may be considered. So it's something that I think we now have to face, rather than allowing our health facilities to be so overwhelmed and we don't know what to do. So, the authorities are being proactive and trying to consider what options we have.
As much as this might sound as a proactive measure, there are concerns as to if we will be able to ensure equitable distribution of healthcare resources across the board.
In what sense do you mean?
If we have a home care and those in the hospitals, because there will be some persons, healthcare personnel that will be asked to go to the homes of these persons who have decided to stay back home instead of going to the hospitals.
Actually, it's not really going to be based on decision or preference. It's more going to be based on an assessment of who needs health facility care the most. So since we know from the epidemiology of the disease that almost 8 out of 10 people who get COVID-19 will either have no symptoms or just mild symptoms, these are the kinds of people that will be considered to be cared for at home. However, there will still need to be an assessment of each case to determine whether or not home isolation or home self-isolation would be ideal for them. There are certain criteria that they would need to fulfill in order for it to work adequately for such a person. So it's less about preference and more about who qualifies and who doesn't.
But there are also concerns that perhaps this could also trigger community spread.
Well, if we don't prepare for a large number of cases and we are unable to handle them, then there will be chaos. If we have people at home and they are properly monitored and they also fulfill the criteria, that is, they have, there are several criteria, people that can care for them, those people will have to be trained. They will be under, supervision from a health facility who will check in on them on a regular basis. We can do something to contain it. And most importantly, there would need to be high level of community engagement, because we would now have to be our brothers and sisters keepers. We will have to have our eyes out in the community to see those that are involved in this type of situation, to ensure that as much as possible they keep to the terms.
Aside this measure, the concern has also been that of the fact that we would be running out of bed spaces. What can government do in that aspect at this point?
Well, from what I know from the government, they are still trying to look for more bed spaces, more centers. And in that regard, there can be decentralization from the isolation treatment centers to maybe more peripheral centers like private hospitals. And I know that for Lagos State, they're trying to add on private health facilities that would qualify. Now they are going looking for them to assess them and accredit them in the care of COVID-19. There had been other muted thoughts like, taking up other centers where they could put in beds or that already have beds. But the challenge I think the government is facing in that regard is that sometimes these organizations may not be willing to give over those facilities for such uses. But where those are available, those are also viable options where they can be taken over by maybe the local government health authority, and then patients there, either asymptomatic or mild, can be kept. We actually do have 1 or 2 holding centers in Lagos right now, I'm reliably informed, where people who really don't have symptoms are just kept away from their families and from other people to reduce infectivity.
All right, Dr. Tolu Olufunlayo, we'll leave the conversation here for now. Thank you for speaking with us. Joining me via Skype is Dr. Tolu Olufunlayo, Chairman, Association of Public Health Physicians of Nigeria, Lagos branch, and a consultant public health physician. Thank you for joining us on TVC Breakfast.
Thank you. Good morning.
Now, what scenarios do you foresee playing out now that we are thinking of going the way of home care with regards to curbing the spread and treatment of COVID-19?
Okay, thank you. Well, this is a tricky one. We've gotten into a phase of high level of community transmission, and we're seeing an exponential rise in cases that is far outstripping our resources for facility care. Now, the World Health Organization does recommend that every confirmed case of COVID-19 ideally should be isolated in a health facility to curb spread. But seeing that that may not be possible at this point in time, rather than allow it to become chaotic and not have, a way of caring for patients, we are now looking outside the box and thinking of decentralizing care. And one of the means of doing so is home-based care, which has its challenges. However, if strict criteria are used, then it may well help us. And the reason why it can work is because though COVID-19 is highly infectious, about 80% of all cases of COVID-19 from previous, what we have seen previously, will not be severe. So asymptomatic, people who have no symptoms or people with only very mild symptoms form the bulk of cases. And these cases are the ones that are being considered for home management. But there must be certain criteria that they would fulfill before they can be considered to be managed at home, so that the treatment would be successful and would not result in another spike in cases. So I think the issue here is that we need to really operationalize this carefully if we want to get good results. If that is done, then it can actually be a help to us at this time.
When you say operationalize carefully, how do you mean?
What I mean is that to have an action plan and make sure that all parts of that plan work, it's going to take several hands being on deck. For example, there has to be a high level of community engagement. We can't have the communities being lackadaisical at that time, towards COVID-19, because if they do, then there would be spread. But if communities are responsible responsible and understand what the problems are, then they themselves would be a check and balance for those people who are being, cared for at home. Of course, we also have to make sure that the homes that are going to be used for home management and the people that are going to be cared for in this way actually meet certain criteria, so that they do not become a harm to the communities and the homes in which they live. For example, they must have ideal caregivers. They must have people that can be trained. They must have a house in which they can have a space to be, self-isolated in, and so on and so forth. The criteria are there. And so what I'm saying is that if these guidelines are followed properly and all hands are on deck, then we can actually manage these people who sometimes don't even feel symptoms. You hear some people who go to the isolation centers and say, well, I didn't even know I was ill. Let me go home. So in a way, home management could actually be helpful. It's just that it has to be properly managed.
I want to quickly take you up on something you said. You said if communities are responsible, at this point, would you say we are responsible enough?
Definitely not. We have not seen Nigerians taking responsibility, and that is my point. That this is the time for government agencies and other organizations to engage our communities more. Let us get home-based, homegrown solutions. Let's actually take up the community on why they have not taken up these public health and social measures that we have so far been preaching. What do they actually think about COVID-19? Do they think it's real? If they don't, how can we actually get them to understand that it is real? If we engage them on a consistent basis at their own level, you'll be amazed at how much change, positive change we can get from the citizenry. So this is one of the major factors. When we do this, then we'll get better results in what we're doing.
One other aspect that was spoken about why the government is looking at this option is the aspect of stigma. Some persons say they are being stigmatized. How do we address this going forward? And another aspect is the fact that when people come to get tested, they disappear, so to speak. How do we bridge this gap?
Well, I think these three things you're talking about, stigma, fear, compliance with public health and social measures, all hinge around engaging the communities. Let's get to the structures that are existing by which we can communicate with them in the languages that they can understand, get their feedback, dialogue with them, and then we can have measures that address their concerns. You see, if a Nigerian feels, oh, we are saying that there's COVID-19 just because the government wants to get money from, some fund somewhere, then he's not going to comply with any measures. But he must realize that if he doesn't comply, his mother or his grandma may get sick and may not recover from it. When he's able to understand that, he would then comply. So that's why I said that community engagement would take care of a lot of things. And for stigma, one of the pluses of home-based management, it does have many negatives or possible negatives, but one of the pluses is that it can help to reduce stigma. It can help if used properly. So these are some of the issues I think the government needs to concern itself with right now, and I believe they are doing that.
All right, Dr. Tolu Olufunlayo, thank you so much for speaking with us.